Without further ado, I'd love to introduce Dr. Kassir. Hi, Dr. Kassir. How are you?
Great, Jacqueline. Thank you for having me on your podcast. And this looks to be a very exciting little time.
Yeah, I feel this is like a really big topic in aesthetic medicine and cosmetic surgery. Would you agree?
Absolutely. I'm a facial plastic surgeon, and for the past 26 years, I've done tremendous amount of nasal surgery, be it rhinoplasty or combination, and also kind of pioneered the non-surgical rhinoplasty in 2006. So what I can tell you, my experience is the nose is a very central and powerful piece in the face. It has a lot of emotional ties, and it's life-changing to alter it.
Yeah, definitely. I feel like the face is something we look at all the time. And the nose specifically is something that I feel like if people hate their nose, they truly hate the way that they look. So I feel like it's life-changing for people. I think the first question that I have for you, and I think this is something that even providers don't know the answer to that are performing non-surgical rhinoplasties, which is a fancy way of saying nose job. How do you determine if a patient is a candidate for surgical or non-surgical rhinoplasties?
Great question. So I didn't do non-surgical rhinoplasties till 2006, and I think I was one of the first ones. And prior to that, there was only surgical options. And then actually one of the housewives of New Jersey kept scheduling her revision rhinoplasty, and then she would cancel and say, I have to go film, or I have to do this. So finally I told her, listen, you're never going to have time to get a surgical procedure. Why don't you let me just contour it a little bit with fillers, just like we do in your lips and in your face? And sure enough, and that was born, and it was great. So one of the answers to your question is there's some people who will never get surgery regardless. Okay, so if somebody is averse to surgery, cannot get surgery because of a medical problem, really doesn't have any time for recovery or anesthesia, that they're deathly afraid of anesthesia. These are all good reasons to do a non-surgical procedure on them. Now, there's differences, and I'm sure we'll talk about this in a minute, in terms of what kind of results you can achieve with each. But you can definitely do something for everyone, and it depends on the person.
Definitely. So you would say if somebody doesn't have as much time for the recovery, a non-surgical option would be the way to go. Is there any anatomical things within nasal anatomy that they are just not a candidate for a non-surgical rhinoplasty? Like, are there any cases that need to be surgical?
So the cases, if you have something about your nose that you don't like, let's say you don't like the bump or the tip or the droop, and you want to contour that a little bit, and then at the same time you have breathing problems or functional problems or sinus problems, or you have a deviated septum, or that's the middle piece of your nose that's crooked, you can't really alter that non-surgically. So if you have aesthetic and functional issues that you can address at the same time, that's a better surgical patient or surgical candidate. But if you don't want any downtime, any recovery, any surgery, any recovery, any of that, you can just do something right now, contour the nose, take it for a test drive, get it.
See how you like it.
Right. And, like we say, rent before you buy, then that's not a bad option to at least kind of dip your toe in the cosmetic pool.
Yes, definitely. So going back to nasal anatomy a little bit, can you talk a little bit about how different ethnicities nasal anatomy is different? Meaning, like, if somebody is Caucasian versus Asian or African American?
Sure. So the main differences in noses are the height of the bridge, meaning how far the bone projects out or sticks out from your face, or how much bone you have here, and the tip of the nose and the nostrils. So usually Occidental or Western noses have a lot of projection, sometimes too much projection, and so you get a hump. And what you want on the side view, you want the tip of the nose to lead the nose, not the bump. So having a bump bothers everyone, okay? Then there's the tip of the nose, which is either round, wide, droopy, and that really bothers people. Mm-hmm. And then especially when you smile, the tip droops down. And then there's the nostrils. And if you kind of look at someone and draw a line from the corners of the inside of their eyes, if their nose or if their nostrils fit in within those lines, that's generally regarded, there's no hard fast rule, but that's generally regarded as normal width. So if you take what we call platyrrhine noses, or more flat, wide noses, and those are some ethnicities, whether it's Asian, Southeast Asian, South American, or Central American, there's very little bridge here, wide nostrils, so you have to actually build the bridge up. You have to add to those noses to make them look a little bit more aesthetic. So, and then the skin type. The thickness of the skin is very important in surgical or non-surgical rhinoplasty. So if they have very, very thick skin, it's hard to make a noticeable enough change doing things non-surgically.
Yeah. Okay, that makes sense. And what about male to female? How do you feel like nasal anatomy differs for these genders?
So usually male noses they're just bigger, they're longer, and they're more tolerated on the face, whether they're a little crooked or they have a little bit of a bump. And that's, for many years, social media has been kind of the court of public opinion. So even if you do male noses that are really crooked and big, and you straighten them out and make them nice aesthetic nose, a lot of comments will be like, well, I liked his nose before. He's a man. He should have a bigger nose.
Like it almost makes them a little bit more feminine because it's so perfect.
Correct. So generally their cartilages are bigger, their noses in general are bigger, and they have a little bit more of an axis deviation because some sort of trauma. Female noses, especially if they're on a petite, tiny face, just a little bit of longer length or an acute angle here or a droop can make a very aesthetic female face look more masculine and less attractive.
Makes sense. So what would you do for my nose? I see you looking at it.
So it's interesting that you asked that. First things first, in all these years, I would tell patients, if they're coming to see us or you, then something bothers them. So if something really bothers you, you have to probably at least consider doing something about it. If somebody's happy with the way they look and their nose, then we leave it alone and we don't even make any suggestions. But and the general rule I have is to make things, especially the nose, not stand out on the face. You want the nose to blend in. We had a patient the other day that said, and they say similar versions of this, that they say, I want to look at my face and not just see nose. And that's a good way of saying you just want it to blend in. Okay, so you can see other things like eyes and eyebrows and lips and cheekbones, and the whole face just opens up.
I feel like filters like on Instagram do that. They make everything proportionate and a little bit more subtle. Nothing's harsh. And I feel like I talk about this a lot, and it's on another episode of my podcast, but filters have definitely changed my practice. Do you feel like they've changed your practice when it comes to rhinoplasties?
Absolutely. We even call it a filter nose. So we have, traditionally we've had the natural nose, the doll nose, the Instagram nose. Now it's the filter nose. The problem with some of these filter noses is they make your face look younger and better. So expectations have gone up, and you have to set realistic expectations with patients, saying you have real skin, real tissues, and we're going to aim for that filtered nose, but this is probably where we're going to land.
Yeah, agreed. I have a very realistic talk with people as soon as they get into my chair that filters are not real. And that I can't make you look like a filter, because a lot of people think that you can, and they think we're magicians, which we obviously slightly might be, but we're not fully there yet. In terms of aging, how does the nasal anatomy change with aging, right? We talk about how the philtrum, or the distance between the nose and your lip, elongates with time. I always hear, my mom used to say this, when you get older, your nose gets bigger and your ears get bigger. So can you explain a little bit about how the nose changes with age?
So you mentioned most of the salient points there. What happens is the skin gets a little bit more elastic and actually gets a little thinner and droopier. The architecture underneath also loosens up a little bit with the same ligaments that hold your face up they hold your nose up. So over time, it's been said that the nose and the ears, just like you mentioned, are the ones that keep growing. So you see with time your face thins out even more, and then the nose relatively looks bigger. So we have a lot of patients that come in after they've had one or two kids. They hit their 30s and 40s and they're like, my nose wasn't that bad, but now it's starting to look really big on my face. I don't know what happened. So a lot of the changes in the facial thinning, the fat, the muscles, the bone, you start losing some of that. The nose then becomes more of a prominent piece in the center. And there's a lot of, gravity changes. You can't help gravity.
I wish I lived on Mars, but Elon Musk didn't get me there yet.
No.
So when talking about recovery, I know we touched on this prior, that obviously surgical recovery is longer than non-surgical recovery. Can you talk about the recovery of a surgical rhinoplasty?
So let's talk quickly about non-surgical rhinoplasty recovery. Most of the time, the worst that you can get is a little bit of a bruise, which we use such tiny needles. So with non-surgical rhinoplasty, there really isn't any recovery. There's no downtime, maybe a little bit of swelling, and no blades or cutting, and patients can go right back to work, and they can do this during their lunch hour, similar to other non-surgical procedures that we do. Surgical, and I've done well over 10,000 of these. We used to contour the nose, do whatever we needed to do to the nose, and then we would take these chisels with a hammer and tap and break the bones. Well, we don't do that anymore. We have ultrasonic instruments. We have these fine micro instruments. So there is no more breaking of bones. You can contour, shape, mold, do anything to the bones. And that's where the pain comes from and everything. So there's minimal bruising, minimal to no pain. We do not even give pain medicines. And
That's
regularly
amazing.
Patients tell us that, you told me there was no pain. I didn't believe you, but there really isn't any pain. How'd you do that? You do, however, have tape on your nose, and usually a little tiny brace for about a week, 6 to 7 days. So during the COVID era, patients were wearing masks. They were working from home. They're still working from home. So the actual recovery, I'll tell patients, you can work out after a week. You can get back to work after a week. But if you don't want anyone to see that you've had anything done, and you may get a little tiny bruise, take a week off, okay? Mm-hmm. The thing with any kind of surgery, including rhinoplasty, though, is you do have to go get anesthesia. You're going to get anesthesia. You're put to sleep for a couple of hours. That day is out. Like that day, you have to recover from anesthesia. But the next day, if you're working remotely, you can get back to work.
Bruising, I know prior when they used to break the nose, you would get bruising under the eyes. Is that still the case with the ultrasound technology?
It's rare. Some people just bruise more than others, but usually you don't get much, as if somebody, maybe like really pressed hard here and that's it.
Yeah.
So bruising and the black eyes and all that are just a thing of the past for us.
So with liquid rhinoplasties, typically people see the result when it's done, right? They leave the office and that's pretty much what it's going to look like. With surgical rhinoplasties, when they take that stent off after a week, is that what it's going to look like when it's fully healed?
Usually I tell people the second you take the splint off, it looks amazing. You can see your result. You still have to give it 12 to 18 months to see the fine detail. But the majority of the look that you have immediately after you take that splint off, albeit it's still a little swollen, is the dramatic difference that they were looking for. Then it puffs out a little bit because the splint's taken off, and then over time it molds and the lymphatics drain your nose, and you get what you want. So, there's always corners that you turn at 3 months, somewhere between the 6 and 9 month mark, and after the 1 year mark.
Forgive me because I worked in body plastics. I didn't work in facial plastics when I was in the OR, but people